6 signs that could indicate fatty liver disease. Fatty liver disease is a serious condition that affects millions of people worldwide. It is also known as hepatic steatosis, which occurs when there is an excessive accumulation of fat in the liver. While some fat in the liver is normal, an excess amount can lead to inflammation and scarring. Overconsumption of omega-6 vegetable oils such as margarine, cottonseed oil, corn oil, soybean oil, or canola oil stands out as a significant contributor to fatty liver disease. These oils contribute to inflammation in liver cells, disrupting the usual fat digestion process. Moreover, the problem can be further intensified by an abundance of sugary foods in one's diet, as these sugars undergo conversion into free fatty acids that clog the liver. Another considerable risk factor is alcohol consumption, as it triggers specific genes instructing the liver to store fat instead of utilizing it for energy. Fatty liver disease is a progressive condition, meaning that if left untreated, it can lead to irreversible liver damage, such as liver fibrosis, cirrhosis, and even liver cancer. By catching the disease in its early stages, individuals have a greater chance of halting or even reversing the progression of fatty liver disease. This is particularly important considering that fatty liver disease often goes unnoticed until it has reached an advanced stage, as it may not cause any noticeable symptoms in its early phases. Therefore, it is crucial to be proactive and aware of the potential signs that could indicate fatty liver disease. Now let's discuss 6 signs that could indicate fatty liver disease. Just a quick reminder, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns. Number 1. Right shoulder pain. When it comes to fatty liver disease, most people think of symptoms such as fatigue, abdominal pain, and swelling in the abdomen. However, one symptom that may come as a surprise is right shoulder pain. But how exactly does right shoulder pain relate to fatty liver disease? When the liver becomes enlarged or inflamed due to fatty liver disease, it can put pressure on the surrounding tissues, including the diaphragm. The diaphragm is a muscle located between the liver and the lungs, and when irritated, it can cause pain to radiate to the right shoulder. This referred pain can be misleading, making individuals believe that their shoulder is the primary source of the pain. It's important to note that right shoulder pain can have other causes, such as muscle strain, injury, gallbladder problems, or even heart issues. However, if you are experiencing persistent right shoulder pain alongside other symptoms of fatty liver disease, it may be worth discussing with your doctor to explore the possibility of a connection. Number 2. Appearance of spider veins. Spider veins, also known as telangiectasias, are a common condition characterized by the appearance of small clusters of dilated blood vessels near the surface of the skin. These veins can appear as tiny red or blue lines or webs, resembling a spider's legs, hence the name. While they are generally harmless and not usually associated with any significant health issues, their presence can sometimes be a warning sign of an underlying problem, such as fatty liver disease. Also note that liver damage often results in elevated estrogen levels as the liver struggles to process excess hormones, disrupting hormonal balance. The elevated estrogen weakens the body's veins, leading to the development of small spider veins on the skin's surface. It is important to note that spider veins can be caused by a variety of factors, including genetics, hormonal changes, pregnancy, obesity, and prolonged sitting or standing. However, if you notice the sudden appearance of spider veins or if they are accompanied by other symptoms such as fatigue, abdominal pain, or jaundice, it is essential to consult with your doctor to determine the underlying cause and rule out any serious conditions such as fatty liver disease. The third sign is the presence of abdominal fat. A protruding abdomen resembling a potbelly or the presence of excess fat around your midsection may be indicative of a potential association with a fatty liver. Abdominal fat, also known as visceral fat, is the fat that accumulates around our waistline. It is not just the jiggly fat we can pinch, but it actually surrounds our internal organs. While some fat in the body is essential for insulation and energy storage, excess abdominal fat can have serious implications for our health, including its role in the development of fatty liver disease. Research has also shown that individuals with excess abdominal fat are more likely to develop fatty liver disease compared to those with lower levels of abdominal fat. The reason behind this connection lies in the metabolic activity of abdominal fat. Unlike subcutaneous fat, which lies just beneath the skin and is considered less harmful, abdominal fat is more metabolically active and releases harmful substances into the bloodstream. Number 4. Swollen right foot. If you notice that your right foot and ankle are noticeably more swollen than the left, this could be a common indicator of liver damage. Fatty liver disease is a complex condition that can affect various aspects of our health, including fluid balance. When the liver becomes compromised by excess fat accumulation, it can struggle to properly regulate fluid distribution in the body. This can lead to fluid retention, which often manifests as swelling in the right foot. So when you press your finger into the swollen area on your foot, it may leave an indentation due to the fluid buildup, a condition known as pitting edema. It is important to note that a swollen right foot alone does not necessarily indicate fatty liver disease, but when combined with other symptoms, it can be a valuable clue for doctors in diagnosing and managing this condition. Number 5. Breast tissue. Recent scientific studies have provided evidence supporting the link between breast tissue and fatty liver disease. These studies have explored the association between breast density and the development of fatty liver disease, shedding light on this surprising correlation. One study published in the Journal of Hepatology examined the medical records of over 50,000 women and found that those with dense breast tissue were more likely to have fatty liver disease. Another study conducted at the University of California, San Francisco, analyzed breast density measurements from mammograms and found that women with higher breast density had a significantly increased risk of fatty liver disease. These findings suggest that breast density may serve as a potential indicator or marker for the presence of fatty liver disease. The research also raises important questions about the underlying mechanisms that connect breast tissue and liver health. Hormones, such as estrogen, have been suggested as potential contributors to the link, but more research is needed to fully understand the connection. Number 6. Constant fatigue. Constant fatigue can be a sign of fatty liver disease due to the impact of excess fat accumulation in the liver on overall energy levels. When the liver is overloaded with fat, it becomes inflamed and impaired in its ability to function properly. This can lead to a decrease in the production of essential substances, such as glucose and proteins, that are needed for energy production and regulation. Furthermore, the inflammation and damage caused by fatty liver disease can disrupt the normal processes of metabolism and detoxification in the liver. As a result, toxins and waste products may build up in the body, causing fatigue and a general feeling of sluggishness. It is important to consult with your doctor, who can evaluate your symptoms and conduct the necessary tests to diagnose fatty liver disease. Early diagnosis and treatment can help prevent further liver damage and improve overall health. Thanks for watching. If you enjoyed this video, like, comment, and subscribe, and click on the bell icon so you never miss a video. We wish you all the best for your health and well-being.